Welcome back. It is 20 to 3 and we are discussing the possibility of a male contraceptive pill today. That's after early stage trials of a non-hormone based male pill were deemed a success and generated global headlines this week. And of course, a lot of the conversation around this breakthrough has been about the impact on family planning and the idea of that becoming a shared responsibility, but it's also raising hopes for couples who until now might have struggled to find reversible contraceptive options. I'm joined now by Dr. Samina Dornan. She's a consultant obstetrician and gynecologist at Al Zahra Hospital here in Dubai. Hello doctor, how are you?
I'm great. How are you?
I'm good, thank you. Thank you so much for joining me. And I guess first of all,
it's a topic I would not miss for the world.
Well, I mean, I'd love to know why. You know, what is your initial reaction to this? Is this as exciting as the headlines suggest?
Absolutely. I mean, for decades, for centuries, women has carried the burden of, contraception. It was all on us. Mm-hmm. And now, for the first time, I mean, this is the biggest news in women, well, one of the biggest news when it comes to medicine in women liberation, that now men can share responsibility with us. Isn't that great?
I think it's fantastic. And I mean, as you say, the pill was a huge step forward for women and for women's liberation and for our ability to plan our families in a way that suited us. And there's no taking away from that. But we talk about it in a very routine way. And for a lot of women, it's not a joke. You know, there are quite a lot of side effects. And I wondered, in your clinical experience, how common are those side effects? And how many women do you see who maybe are having problems with the pill but don't feel like they've got an alternative?
Well, actually, the side effect of the pills are only temporarily. Mm-hmm. You know, women, you are taking a hormone which is going to suppress your ovary. So your body is going to fight it, react to it. Mm-hmm. So I would always tell them, please persevere with it for a month or two. And initially you will also have a 10% retention of fluid, which you feel you have gained weight. So this misconception that, you gain weight on the pill is actually only a temporary effect. But because women are happier on the pill, because of the premenstrual syndromes, because of the endometriosis, and also because of the no fear of getting pregnant. So when you are happy, you gain weight. Do you know what I mean? So it is just one of those things. But saying all that, pill had been a problem with people who have a very strong family history of a breast cancer or themselves and things. But women do have alternatives as well. For example, hormonal or non-hormonal contraceptive devices, So, in all fairness, I mean, I wouldn't look at it and say, look, for the men, they have developed a non-hormonal pill. But for women, we have other devices, and we also have different system. It's not just the egg production. Mm-hmm. We also have menstrual disorders, and so when we talk about female contraception, we have to think about a lot of things, not just one aspect of fertility.
And so on that note, I mean, the fact that this would potentially make this a sort of shared responsibility, how do you think that would change the conversation that you have with your patients around family planning and how they approach it?
But you see, whether you counsel women or not, still a lot of women are scared of hormonal pills. Mm-hmm. They don't want to take it. Yeah. And then it comes to men to either use condoms or vasectomy, which is a permanent procedure. Naturally, it's not something which anyone would like, even, the partner wouldn't like. And we don't suggest I usually don't suggest a permanent procedure for women or men, because we live in a time where for women there are so many options. And I say, you never know in life, don't give up all your options so easily. So now, and men in a relationship, in marriage, they don't like using barrier methods, condoms, So this makes it so much easier, the conversation, who will use it and this. But it also depends, this conversation, are you having it in a liberal, open society, open-minded couples, or are you having this conversation in a patriotic society, religiously, bound society, where fertility is seen as a crown for the man, and you are not a man enough if you are using a pill. Do you know what I mean? It depends where the debate takes us. Is it a social stigma? Or thinking, oh, he's not a man enough that he's using a pill, or we are entering into a new free era where men are saying, well, great, I can control, and all these unplanned pregnancy, I can take responsibility for my own planning. But also it takes us to another debate. Will men be honest and transparent, or will they use this as a weapon? So there are so many frontiers that we can talk about, and I don't think your program is long enough.
It's a very fair point. And I mean, I think, having this discussion, you would hope that that we're talking about relationships where there is a position of trust. And presumably when you're speaking to couples, most of the time that is the case. They wouldn't be in your office together if that wasn't. But there is a really sort of interesting point there. And I guess the evening of the playing field here is that it means that both members of a couple have the option to take control for themselves. Yeah. In that sense, how do you think that this could help address some of the issues that you see when couples come to you and they're maybe struggling to conceive? Because we know that, for some women, it can take, as I was saying to Dr. Luciano, it can take a while for the pill to come out of your system, or maybe they're struggling to work out why they're not conceiving. Presumably having as many options as possible on the table is a good thing in that picture. But how does it change the dynamic of the discussion?
Well, it wouldn't, because even now women think that some women that pill can cause infertility. You might be having a risk of a low ovarian reserve before you started the pill. Do you know what I mean? That's why we tell people, please have children as soon as possible. In medical books, if you haven't had your first child by the age of 28 and you are pregnant at that age, we call you a great age, and you are elderly primi gravida. Do you know what I mean? So you are known as elderly primi gravida, first time pregnancy.
At 28?
So, at the age of 28. And this is a medical fact. It's not a society or it's not a social discussion. It is a medical fact that your fertility starts going down. If you ever see, we talk about teenage pregnancy and how terrible it is and all this. I mean, they spring out of pregnancy, and delivery just like that, They're magnificent. At the age of 18, 19, oh my God. So I know this is not a debate. I am not saying that all women should have children at that age, but what I am saying is talking about medical facts. And I know we want to have a career and this and that, but medical facts are the sooner you have your children, the better you are. The longer you leave them, whether it's a pill or no pill, you will have problems. So I have that debate with them in the clinic with women to say, you sure if I go on pill, my fertility will not be compromised? And my answer to them is, your fertility will be compromised whether you go on a pill or not, because you are growing older every day.
Mm-hmm. And so the longer we wait, the more chance that we are going to be challenged.
And that is where the debate comes with Luciano, that women should start freezing their eggs if they have if they have a long-standing plans. So Demetrius, Luciano, the fertility guys would say, come on, talk to us. How long is your plan? And you have seen very recently that an embryo frozen in 1973 has been successfully transferred and the baby has been born. So it doesn't matter if you freeze your eggs for a year or 10 years or 100 years, it will be fine.
It's a really extraordinary time, really, for this field of medicine. I wonder, to take it back to the start of this conversation, why is it that you're so excited about this trial? What is your hope for say 5 years from now, if this pill or other male contraceptives are being tested as well? What is your sort of big picture wish for a more equal environment when it comes to sort of responsibility for birth control?
I think it is because it will encourage open mutual dialogue in relationship where contraception is no longer the woman's sole domain. It can be empowering for men who do not want children but also want to avoid permanent solution, right, like vasectomy. I mean, we keep talking about women empowerment. That's fine, but what about men empowerment? In a lot of societies, men are not empowered as well. They are forced to have children. They are forced to, it is seen to be important thing for them to prove. And then they, don't have a control. And there are women who are demanding and they want more and more children. Men doesn't want children or that many children. So I feel this opens the debate and a conversation. And this will also challenge the cultural resistance, the religious, resistance, everything. And I like challenging society at its deepest levels.
Making it an open conversation presumably is better for everybody involved, as you say, for men, for women, for families. The more open we can be about these conversations, the better. And the sooner we can be open about these conversations as well, I guess, to try and avoid problems in the future.
Absolutely. May reduce gender double standards in reproductive planning, for instance. Women are often blamed for unintended pregnancies. This could shift. We can start blaming men now. You know what I mean? There are so many levels that we should celebrate science at this new development. And men should be very happy because for a long, long time, this got delayed because they were looking at the same thing, hormonal treatment for men. And they were using the testosterones, but which was causing in men a lack of libido, lack of desire. I should use simpler words. Lack of sex desire. They became moody. Just like women go through when they go through menopause, they were going through menopause. And they were also gaining weight. So that was not going to work. This pill is changing all those dynamics. And because it is not it is called, just for a public, YCT529. It is non-hormonal. What it does, it blocks the receptors which are needed for vitamin A to produce sperm. So it is not affecting men's hormones at all. Nothing. And its first phase is over, which was 1A, in which it was used in 16 individuals in United Kingdom from different age group, older, younger. And it was seen to be 99% effective, over 99% effective, and it had no significant side effects, and it was fully reversible. So all those things. So now it will be, this will come out, I think, in August. It's not fully out, just headlines are out. The full picture will be evident soon. And then they are doing the next phase, the 2A, 1B, what we call it, which is a larger number of male, which will be tried on for a longer time. And the second phase is very important because we are going to see, is there a long-term effects on men by using that. So the pill will not be available for general consumption before 2027, maybe 2030.
Yeah. Interesting times, very exciting times. We're going to be keeping a really close eye on those trials. I'm sure we'll talk to you again very soon, Doctor. You've been listening to Dr. Samina Dornan. She's a consultant obstetrician and gynecologist at Al Zahra Hospital in Dubai.